Good day, and welcome to Leadership and Management with me, Nurse Myron. For today's episode, we will be discussing the Patient's Bill of Rights. For our full disclosure, I declare no financial, personal, or professional relationships with any commercial entities in this series. Any mention of specific products, companies, or brand names is solely for educational purposes and does not constitute an endorsement or recommendation. The data, case studies, and examples presented here are used exclusively for instructional purposes and should not be interpreted as clinical guidance or used as evidence in active practice. The Patient's Bill of Rights is a foundational concept that must be understood by all nurses. This serves as a protection for patients and also ensures that the nurses deliver high quality and patient centered care. We begin with the foundational premise of healthcare: the right to considerate and respectful care. In any hospital, this is not merely a courtesy, it is a performance metric. Respect is the operational baseline that dictates our culture of safety. When a patient feels ignored or dehumanized, their physiological stress response increases, directly impacting patient outcomes and recovery times. As nurse leaders, our duty is to cultivate an environment where respect is institutionalized, not optional. We must check that our daily interactions ensure that every member of the healthcare team, from clinical staff, nurses, to the support personnel, janitorial services, security personnel, reflects this standard. By enforcing this right, we do more than protecting a patient's dignity. We are building the trust that is required for complex clinical interventions to succeed. Respect is the prerequisite for all other forms of clinical excellence. Next, we have the right to information. Communication is the primary tool of the modern clinician. The patient has the right to receive complete, current, and understandable information regarding their diagnosis, treatment, and prognosis. From a management perspective, this is a challenge of translation. We are not just providing medical data, we are providing meaningful clinical knowledge that the patient can use to navigate their own health journey. When we fail to communicate in terms a patient understands, we create a barrier that leads to non-compliance and even clinical errors. As administrators, we must support our staff by providing the communication tools, resources, and training necessary to bridge the health literacy gap. We are, after all, the architects of the patient's understanding. When we hold back or obfuscate the information, we undermine the shared decision-making process, which is critical for positive longitudinal health outcomes of the patient. Next, we have the right to informed consent. Informed consent is the ethical and legal threshold for all medical procedures. It is the patient's right to possess all information necessary to make an autonomous decision regarding their care. Administrative leadership demands that we view informed consent not as a simple signature on a piece of paper, but a deliberate and unhurried process of dialogue. If the patient does not understand the risks, benefits, and alternatives, the consent is neither truly informed nor legally valid. We must therefore ensure that our nursing and medical teams have the time, environment, and documentation protocols to facilitate these high-stakes conversations. We are protecting both the patient's autonomy and the institution's integrity. We must prioritize this right to transform from a defensive bureaucratic hurdle into a robust and patient-centered partnership. Now we move on to the right to refuse treatment. This right is the ultimate expression of bodily autonomy. It is the patient's prerogative to decline any intervention, provided that they are informed of the clinical consequences of that refusal. For the nurse administrator, this presents a unique challenge, balancing our commitment to patient well-being with our respect for their self-determination. When a patient chooses to refuse, it is our duty to ensure that this choice is an informed one, documented thoroughly, and managed with empathy. This is where leadership as a nurse is tested. We must provide the counseling and education needed to ensure that the patient understands the gravity of their choice, while protecting them from undue pressure. Our role is to remain the objective advocate, ensuring that the patient's voice remains the final authority in their personal medical narrative. We move on to the right to privacy. It is the cornerstone of the healing environment. Every patient has the right to absolute consideration regarding the privacy of their medical care program. In a specialty hospital, privacy is often the first thing to be sacrificed, but that is an operational failure. Whether it is during physical examination, clinical discussion, or the handling of sensitive patient information, we must create physical and digital systems that protect the patient from unnecessary exposure. We are the guardians of the patient's sense of self. When a patient feels vulnerable, their ability to participate in their own care diminishes. By prioritizing privacy in our nursing workflows, we signal to the patient that their dignity is non-negotiable and that our profession has a high standard of care. Now, related to privacy is confidentiality. It is the bedrock of patient-nurse relationship. A patient has the right to expect that all communications and records regarding their care are treated as strictly confidential. In our digital age, this extends beyond keeping the paper charts secure. We must observe rigorous protection of electronic health records. Any breach of confidentiality is a failure in the system. If patients fear that their data will be shared inappropriately, they will withhold vital information, and therefore, clinical safety will be compromised. As nurses, we must follow our policies on data stewardship and ensure that every staff member understands the ethical and legal weight of their access to patient data. Confidentiality is a trust buffer that allows patients to be fully honest with us, which is essential for accurate diagnosis and effective treatment. We move on to the right to responsive service. Patients enter our doors because they are in need, and they have the right to expect a reasonable response to their requests for our services within the capacity of the institution. This is the service-oriented mandate of healthcare administration. Our systems, our staffing levels, our emergency response times, our triage protocols, all of these must be calibrated to meet patients' needs with speed and efficacy. Every time we leave a patient's call light unanswered or a request unaddressed, we are effectively telling them that their needs are secondary. Operational responsiveness is a reflection of our clinical readiness. We must therefore monitor our response times, identify bottlenecks in our nursing service, and ensure that our commitment to patient care is visible in our day-to-day administrative performance. We move on to the right to information on relationships. Modern healthcare is a complex web of institutions, partners, and individual healthcare providers. A patient has the right to know the relationships between their hospital and other health or educational entities, as well as the professional roles of those treating them. Transparency in governance builds trust. A patient should never wonder who is caring for them or what institutional interests are at play. By clearly identifying team members and disclosing partnerships, we alleviate patient anxiety and clarify lines of accountability. As nurse leaders, we should embrace this transparency. It ensures that patients are empowered to ask the right questions and that our institutional partnerships remain aligned with the best interests of the patient. Clear roles lead to clear communication and better collaborative care. Now we have the right to refuse participation in experimentation. The advancement of medicine is essential, but it must never supersede the rights of the individual person. A patient has the right to be advised if the hospital plans to engage in human experimentation, and more importantly, the right to refuse participation in such. This right is the check and balance against potential overreach of clinical research. In an academic or high research hospital setting, we must be impeccable in our ethics. Informed consent for research must be separate, explicit, and free from coercion. Our leadership role is to act as the internal ethics committee, ensuring that no patient feels that their standard of care is conditional upon their participation or non-participation in any trial. Patient safety and choice must always be the priority, regardless of the potential academic benefits. The right to continuity of care. Care is a journey, not a single destination, and patients have the right to expect reasonable continuity. Fragmentation is the enemy of patient safety. When a patient is transferred, discharged, or shifted between departments, the error risk increases. Continuity of care is an administrative responsibility. It requires us to manage handoffs, discharge planning, and follow-up communication with extreme precision. We therefore must build systems that follow the patient, ensuring that their medical records and their clinical story remains intact as they move through our facility. Our goal is to ensure that the patient feels supported long after they leave the bedside. Continuity is the glue that prevents patients from falling through the cracks, and it is a key metric for institutional quality. Moving forward, the patient has the right to understand his or her bill. The financial aspect of healthcare is often the most confusing part for the patient. A patient has the right to examine and receive a clear explanation of their bill, regardless of their source of payment. Administrators should require us to be transparent with finances as we are with our clinical care. We must ensure that our billing processes are accessible and that our staff nurses are capable of explaining charges in terms that alleviate rather than create distress to the patient. Financial transparency is a matter of ethics. It honors the patient's commitment to the institution. When we clarify the costs and ensure the patient understands what they are paying for, we build an institutional reputation of fairness, honesty, and accountability. Finally, the patient has the right to know what rules and regulations apply to their conduct. Clarity is the foundation of a safe environment. We cannot expect a patient to adhere to policies if they have not been clearly informed of them. Whether it is regarding visitation hours, safety protocols, or patient behavior, these rules exist to protect the patient and the entire clinical team. As administrators, we should present these regulations not simply as a list of do's and don'ts, but as a framework for a safe and healing environment. By setting clear expectations from the start, we empower the patient to be an active, compliant participant in their own care, reducing conflict and fostering a more harmonious and productive hospital environment for everyone. Thank you for watching our episode on the Patient's Bill of Rights, part of our series, Leadership and Management with me, Nurse Myron. By knowing these rights, I am confident that you can better care for our patients. I hope you learned a lot today. And as always, continue enjoying learning.